part of our board of advisors, done an extraordinary job. And at the last Imogen experience, he did present for us, and I had a lot of phenomenal comments on his presentation. So it's great to have him. He's also a longtime friend of mine, one of the longest people I've worked with, and got to share a lot of stories. Went through a lot of education, and became good friends in this time that we've been working together. So it's a real pleasure to have him here and go through the introduction of Cardio Essentials and how it can work into practice and what we can do with this. So I'm going to let you take it away, Keith.
Okay, very good. Thank you, everybody, for logging in today and this evening and this afternoon, depends on where you're at. And I was excited whenever Mike asked me to do this, and I started doing research to find out more information. And the first thing I came across was, besides I already knew and experienced this in my practice and even in my family, how well these ingredients lowered cholesterol, I was amazed to find out how they affected the function of the blood vessels. And so I kind of titled this More Than Lowering Cholesterol, a Natural Cardiovascular Solution. So I'm going to share some of this research behind this product. And tonight we're going to be talking about each of the single nutrients and their effects on the lipids and artery function and the effect of combining products. And then also patient handout and CoQ10 and statin research references are going to be available. And then also just a few little simple things to do in your office to get an idea if your patients have some concerns about arterial function, meaning kind of starting to have problems with atherosclerosis type issues. So we'll go ahead and get started. In my practice, a lot of people come in and they don't want to take prescription products, and so one of the first things they'll say is, well, do I need to take it? Do I really need to lower my cholesterol? And once again, in this kind of the natural area, a lot of patients in the public are getting some information stating that for some people it doesn't make a difference on their cholesterol. Well, really it does. And so I have some references here on the increased risk of heart disease and myocardial infarction. And if you notice all these references, these are just references through April of 2010, talking about how elevated cholesterol, lipids, triglycerides increase the risk of heart disease and myocardial infarction. And then the same thing with stroke. And once again, this is just going through April. Numerous risk factors associated with that and the atherosclerosis that does occur. And the same thing, even now, we're seeing macular degeneration is actually also definitely partially, if not maybe even totally, caused by vascular disease, even cataracts, and even, let's see, nope, didn't get into that, but I found an article about dizziness and about sudden hearing loss related to vascular disease. So a lot of these organ dysfunctions may be caused by poor circulation to the blood vessels. So here's some information about red yeast rice. An extract of this red yeast rice has been purified. In this particular study, was given to over 1,500 patients that had high blood pressure and a history of a myocardial infarction, and they took it for over 4 years. And they noticed that in these patients that they had over a 38% reduction in the risk of coronary events, and also reduced the risk of coronary heart disease death by over 29%. And so not just talking about lowering cholesterol, but there's something else going on, that's having such a dramatic effect on lowering these numbers. Another study showing that the extract also given for 72 months to 28 patients, kind of a smaller study, and then a placebo to 27 patients, showed that it actually improved the left ventricular diastolic function. And it also, in the same study, decreased C-reactive protein, an inflammation marker, once again, more than just cholesterol. Another study, red yeast rice, was given to 5,000 patients with a history of the MI for 4.5 years. A very similar type study as the other one, but it was totally different. 45% reduction in major coronary events, decreased cardiovascular mortality, decreased total mortality just from all causes, decreased coronary revascularization by 33. So they didn't have to do as many surgeries on these patients. And in this one, they did show that it lowered cholesterol, LDL, triglycerides, and also helped improve HDL. And this is from the American Journal of Cardiology. So this is not just an alternative journal, major, well-publicized journal talking about these natural products. And doctors are recommending these products to their patients. Just general practitioners are saying that they need to be taking these things. They're reading these same journals. Another study, just talking about other things, what red yeast and rice can do, is another test tube study showed that the red yeast rice actually lowered homocysteine levels, lowered homocysteine-induced reactive oxygen species or oxidative damage, and also lowered inflammation via the NF-kappa B activation. And then in a rabbit study, also reduced the oxidative damage, release of the chemical MDA, and then also helped reduce the lipids going into the aortic wall. And these particular rabbits were fed a very fatty, high cholesterol, really almost a nasty kind of a diet for a rabbit. So it wasn't just lettuce. They're eating other things. That's a German research article. And then once again, another study showing that in 48 patients with stable angina, after just even 1 day of taking 1,200 milligrams of red yeast rice, their hsCRP dropped by about 13%. So just that one fact, just that 1 day, they had a major decrease in a risk factor. And after 48 days, their hsCRP dropped by over 28%. In another study, 50 patients took 1,200 milligrams before and after, and improved their before and after function of their blood vessels, how well they opened up and dilated, and once again lowered hsCRP and triglycerides. That's kind of a common question that we do. I do a lot of blood tests, and what can we do to help lower hsCRP? And so this is definitely something that's worth considering. Another ingredient in Cardio Essentials is niacin, and there's a tremendous amount of research about niacin and also about combining niacin with statin drugs. In this particular study, there were 15 patients with diabetes. They were taking statin drugs, and they were taking 1,500 milligrams of nicotinic acid in a prolonged time-release type product. They measured the forearm blood flow and compliance, which is also called flexibility as a common term for that. And so they found out that the niacin itself helped to relax and allow those blood vessels to become more compliant or flexible. And then also in this study at 1,500 milligrams a day decreased serum triglycerides by 47%. And actually I've seen even better results than that. Even in a family member had very high triglycerides. Another study in patients with AIDS that had low HDL, they were given extended-release niacin, and once again they found that it helped dilate and open up the blood vessels. And the patients that did not get the niacin, they actually had a decrease in the dilation. So the atherosclerosis in this time period actually got worse. That's a new article just published a few months ago. And overall, there's a research review that showed 7 studies with a total of over 5,000 patients that niacin decreased non-fatal heart attacks, strokes, TIAs, and cardiac mortality. Once again, I'm still basically in 2010. I'm not getting into other months and years here. Niacin, in an extended-release formulation, was given to mice 2 hours after they induced a stroke. In these mice, they gave them a chemical blood clot. They actually gave them niacin, and they found out that niacin reduced the infarct volume or the size of that blood clot and the damage to the brain. And it improved their neurological outcome and protected those brain cells from dying after the blood clot. So a lot of research going on with this, and a lot of animal studies in some of these type things. In a rat study, they found out that niacin, it's actually the same group of people did this study, another study, niacin the prolonged release niacin treatment of the stroke actually helped with the plasticity or the flexibility and the axon growth in the brain cell. So they're actually starting to evaluate this, and they're going to be doing additional animal studies and trying to apply this in humans too, as potentially a treatment in stroke for niacin. Even back, and so I didn't go back to 1988, but there's some research showing that the expert panel of NCEP by the National Institutes of Health designated niacin as a first-line therapy, the first thing to do in treatment of high cholesterol and triglycerides. And as a matter of fact, back then, I had a pharmacy, and definitely doctors took notice of this. And there is a prescription product. They were writing for it. And we actually, we were actually dispensing a lot of prescriptions at that time for niacin. Cardio Essentials does have the niacin in it, and what's so nice about niacin is that it actually takes care of just everything as far as cholesterol-type products. And this actually, in my practice, is the first thing I typically like to go with. I try to go with nutraceuticals first. I'll reserve herbal-type things at a later time, but in this case, it actually helps lower the HDL and increase the HDL, lower the LDL, lower the total cholesterol, and significantly can lower triglycerides, and then also help with LPA. And then also, niacin has been consistently effective for raising and improving HDL levels. I take it myself for that very reason right there. Genetically, some of us, no matter what we do, no matter what we exercise, no matter what we eat, genetically, some people are just going to be low in HDL. Also, it does help lower total cholesterol, LDL, VLDL. So those that are doing the expanded the expanded cholesterol panels, niacin always comes in almost every single thing that a patient can have. Niacin and fish oil are typically always listed in that, as can help with that. It does help out, once again, with that fancy, larger panel, the Berkeley and VAP panels. It shifts the size of the LDL from small, dense, to large and fluffy, as some people will say, size of the LDL particles. And then also, it's the only nutrient that, or even pharmaceutical, that's been shown to help lower lipoprotein consistently. And then also, it's very effective given with statins. Many research articles. And matter of fact, when patients first started coming into my office, I was a little bit concerned about it and about doubling up on a statin and niacin. And we actually followed a lot of people with liver enzymes, and we never have seen any problems with that. And also very cost-effective. So once again, niacin is my first choice. Everybody in my practice, every patient comes in, they do get fish oil, and we're going to see some of the reasons why. They actually gave, recently, a study published, gave 1 gram of EPA and DHA or placebo to men and women with a fat meal, high-fat meal, a bad meal. They then measured their brachial artery blood flow and the dilation that occurred. And what they found was that the high-fat meal decreased the dilation or opening of that blood vessel. But then if they did take the fish oil, they actually had unchanged, which means really improved compared to the placebo effect on that blood vessel. And so it's very neat to be able to measure that type of effect in the body. Also, omega-3 supplements, 1 gram of omega-3 ethyl esters added in combination of aspirin and Plaxel significantly potentiated the platelet response after surgeries. And so I believe there's even another study talking about, adding omega-3 acids to aspirin treatment reverses aspirin resistance. And this is something that there is a test that's available. There are some labs that do this. I have not done that very often in my practice, and so I just typically, I give everybody fish oil. But it's kind of neat to be able to keep them from becoming resistant. And actually, one study that I came across, it mentioned that up to half of the people taking aspirin are resistant to it. That's a major fact. So the people and doctors are thinking that they're doing good, and they're taking maybe an 81 milligram aspirin, and it's not even doing anything. So omega-3 fatty acids can actually improve the aspirin effectiveness. Johns Hopkins Prevention Center for Heart Disease stated omega-3s exert their cardioprotective effects through many different mechanisms, including reducing arrhythmias, reducing inflammation, and improves the platelet and endothelial function, blood vessel function. To this date, this was actually just published this year, no serious adverse effects of omega-3s have been identified, despite extensive studies. And then concerns, which always we're always very careful about, concerns over increased bleeding complications have not materialized. I actually have seen more issues with vitamin E than I have with fish oil. And even when used with aspirin and other anti-clotting prescription products. And so Johns Hopkins, they're recommending that a person obtain one serving, which is 200 to 400 grams of fatty fish. And actually, I didn't think about, 3 ounces. To me, that sounds like maybe a lot of fish. But 200 to 400 grams of fatty fish or a fish oil supplement containing at least 900 milligrams of EPA plus DHA every day. And then a diet rich in ALA, which include nuts and seeds, basically. It's great for patients with known cardiovascular disease or congestive heart failure. And then also dietary and non-dietary intake of omega-3 fatty acids overall reduces mortality due to MIs and sudden death in patients with CHD. Kind of sounds familiar to the niacin studies. Reduces heart rate, which is also a major risk factor for sudden death. Among patients with implantable defibrillators, omega-3 fatty acids do not reduce the risk of tachycardia and may actually be pro-arrhythmic. I went and threw that in there just because there definitely are. I have 3 patients with defibrillators, and so that's something that we may have to consider, in looking at the program. So this is an article that was published this month, and then also the omega-3 fatty acids, given at a high enough of a dose, can provide anywhere from a 10 to 33% decrease of triglyceride levels. And go back up to the tachycardia ventricular fib. The issue with that is that it may be oxidative damage. So if the patients, they feel like if the patients weren't getting enough antioxidants, it actually was starting to damage the body a little bit. And they don't know why. Once again, a new study and on that. So we just have to be a little extra careful about those patients with the defibrillators. 4 grams per day has been shown in the Journal of Hypertension to decrease blood pressure, heart rate, and decrease triglycerides by 24%. So that's kind of a minimum. Once again, I've seen some tremendous things with high dose of fish oils on triglycerides and even blood sugars. CoQ10 is another ingredient in the Cardio Essentials, and in patients that were taking a statin drug, they found out when mortality was significantly higher among patients that had. Let me back up just a second. Mortality was significantly higher among patients in the lowest amount of CoQ10. And also in that same study, they stated that the statin drug reduced CoQ10. They did not state that the statin drug increased mortality issues, but that patients that had low levels had problems. So they were being very, very careful about what they were saying there. CoQ10 is critical for energy production in the cells. The heart, the brain, some of the most active organs in the body require that CoQ10 to make ATP for energy, and statin drugs definitely can decrease this. And before I forget, just make sure I don't forget this later on in the seminar, there's going to be, I have my email address on here, and you can email me, and I'll provide you a sheet that has a simple handout sheet with the references showing the concerns about statin drugs, lowering CoQ10 levels. So just email me on that and let me know about CoQ10, and I'll be happy to send that to you. Also, An analysis reviewing many different studies showed that CoQ10 improved ejection fraction, the amount of blood the heart's pumping, by 3.7%. And then actually in patients that were not taking ACE inhibitors, we saw an improvement by an even greater amount, by 6.7%. So CoQ10 depletion may be a contributing factor as to why statin drugs may not improve outcomes in congestive heart failure. That's not me talking. That actually in this case is the New Zealand Journal of Medicine. So so there's definitely a lot of research, and once again, that's just October of 2009, just a year ago. This was published. CoQ10 does help decrease the LDL oxidation and the progression of atherosclerosis. It helps improve the blood supply, throughout the heart and the blood vessels. Low levels are an independent risk factor for mortality in congestive heart failure. Matter of fact, I had one gentleman that was 98 years old, came in years ago, and I had a compounding pharmacy at that time, and actually his granddaughter came in, and he had congestive heart failure on hospice, and literally just months to live. And his daughter remembered that hospice would pay for dietary supplements with a doctor's order. So I provided the doctor with research showing how, this CoQ10 may help out with congestive heart failure. He could not even swallow a pill. And so I actually took the powder, compounded powder, I added it to flaxseed oil, gave that to him, and it's amazing. Within 2 years, he was actually going back to church. So about the time he was 100, he had actually recovered. He was on hospice. Now he's going back to church. And he ended up living, I think, for about 5 years from that time. Got to the point where he could swallow pills, and he did convert over to pills. So it's really neat. And then here's some other research that I mentioned about vertigo and Meniere-like syndrome, finding that there's not only maybe some energy issues, but maybe some circulation issues, and some other health issues. And also CoQ10, due to the energy type issues and ATP production, increased exercise tolerance and heart function. Okay, now combination therapy. So that's what we're presenting here with this product is, what happens when we add these products together. And there was a 12-week study of 74 patients that were overweight, had high cholesterol, and they either gave them red yeast on rice, about 3 grams per day, fish oil, and therapeutic lifestyle changes, or statin drug by itself. And actually, combination, the red yeast on rice and omega-3s decreased LDL by 42%, triglycerides by 51%, and those patients even lost weight, which is really neat, and actually goes back to that triglyceride issue. As I tell my patients, triglycerides are caused by too much sugar in the body. If the body can't get rid of that sugar or the glucose, it's either going to make belly fat and or a combination of triglyceride fat. And so that's a matter of fact, many people we see above that 150 mark or even approaching that, they're actually, in a pre-diabetes situation. The higher the number, the greater the likelihood they have glucose issues. And so it did definitely work better. And actually patients that were on the statin drug actually gained a little bit of weight. Combination also of a statin with niacin. The American Journal of Medicine, October 2010, states, evidence supports the addition of niacin as the second agent, adding it on top of a statin drug. In some situations, a high-dose omega-3 fatty acid should be the first agent added to statins. Now, they didn't say, exactly, what their criteria was on this, but whenever glucose is elevated and triglycerides, the omega-3s are the first thing to add on. We've got to get the blood sugars down. The glucose issues themselves can cause some cardiovascular damage. And another study, statin plus extended-release niacin. When niacin was added to statin therapy, the extended-release version of that decreased HCl and actually helped reduce that atherosclerosis measured on the thickness of the blood vessel wall within 24 months. So definitely, there's methods and things that you can do to actually show how the blood vessels are functioning better and getting better in the body. And including one option on that would be an ultrasound. They can do ultrasounds on the carotid arteries and give that type of information. A study about it was statin and niacin or omega-3s, patients with type 2 diabetes and metabolic syndrome, adding either niacin or the omega-3s provides a greater opportunity to achieve their non-HDL and ApoB targets. So once again, a lot of research on this. I'm still just in the past 2 years. Statin and niacin, additions of niacin to statin therapy provided multiple favorable effects, and the combination seems to be safe as the individual drugs separately. So they're actually following these patients, doing blood work, and not seeing any issues, with liver enzymes and kidney things were not showing up. Combination therapy for years. They've actually been following this about niacin and statin drugs. In a summary of 4 different studies shows that triglycerides decrease anywhere from 25 to 47%, LDL decreases 5 to 50%, and HDL increases anywhere from 4 to 45%. I've seen that in mine too. So I've seen some good numbers improve on that. There is a potential issue about toxicities. Citrulline is a kidney toxin, a mycotoxin, and has not been detected in assays of Zymergen's product, but it has been found in other products in the past. So it is potentially an issue, and patients, if they're going to be shopping around, trying to get the cheapest thing, well, we need to be sure and warn them about that. The potential about niacin. So in dispensing prescription products, there are some products prescription products that have a tendency to create some elevated liver enzymes. Years ago, back in the 80s, I did see 1 or 2 people, probably out of 100, that had an issue. So it was not common, but still a potential issue. And so we do want to monitor patients and not only do lipid profiles, but we also want to be doing liver enzymes to see if there's anything going on. So there's a possibility there may be a change, but usually it's something that has tendency to correct itself. Limited concern, far outweighs the data, about the potential issues. Initiation of a high-dose niacin should be done under supervision of a trained healthcare professional. So niacin just out in the public without a blood test, there's always that possibility something could go wrong. In addition to follow-up lipid analysis, liver profiles should be performed every 2 to 3 months for the first year, and then once yearly, if everything remains normal. And actually, I've been using niacin by itself and in combination for the past 3 or 4 years, and I've yet to see anything, and once again, in hundreds of people. So it's just not an issue in my practice yet. Potential side effects, and I speak from experience on this. There may be. I always tell my patients that something could happen. And my story is, when I take the niacin products, my ears turn a little bit red and get a little bit flushed and itch just a little bit, especially when I get a little bit emotional or excited. And so, but I don't get a feeling of warmth or like a whole body flush. But in my case, it's just my ears. I get easily embarrassed anyway, so that's part of the issue. But so what happens is that niacin does help dilate those blood vessels near the skin surface. And there's also potentially the issue about histamine. So we'll talk about that in just a moment. The episodes, if they happen, are just last very shortly, a few moments. So for me, it's just something I notice, and then literally it's just gone, after just a moment or two. Rarely would it last over 2 hours. And then also, as a person typically takes the product, I have less problems now than I did 2 years ago. And so it's not harmful. If they do have some issues, they should stop the dose. As a matter of fact, I always recommend that they just let me know so I can help provide information and counsel with them on what to do. So if there is a problem, you can actually precede the niacin dose with an ordinary aspirin by about 60 minutes. We want to get that aspirin into the blood system. Can also take it with food, not on an empty stomach, or especially hot drinks, spicy foods. And then taking niacin at bedtime is definitely another option, and taking it with vitamin C may also help. So these are some ways to help decrease some of the histamine issues that may be related to the niacin. Cardio Essentials contains each packet, there's 60 packets in a container, contains 1 CoQ Max, 50 milligrams, 1 Omega Pure 600, red yeast rice 900, and a Niavasc 500 milligrams. So it's pretty convenient, and the dose on that is typically 1 packet twice a day. And the only issue, let's see if I can go back on that, the only issue I would say, by chance, if a person has noticed that they can't sleep as good with this, it may be due to the CoQ10. And with my patients, a few people have complained that they don't sleep as good when they take CoQ10, and maybe because of energy production. Some people can feel that energy, some can't. So we do recommend maybe early, more like supper time, rather than a bedtime dose, for that if they notice that kind of an issue. And we have a special, so I'll let Mike talk about this a little bit, about the special, and then I have a couple more slides. So, Mike, are you still here?
You bet, I'm here. We want to thank everybody by giving them the opportunity to start using Cardio Essentials. It'll be in Friday or Monday. You guys can place your orders at the office. They'll be ready for those. You'll get the first set of products that comes in. You have a 15% off special, which allows you 15% off, and you have free shipping. So if you order 1, you get free shipping, and you get 15% off. If you order 6 or more units, you get 20% off, and you will qualify free shipping if you're underneath our shipping amount. You can see right here the suggested retail price is $81. Professional price is $48.99, and there's everything that's contained in there. So, and now we're going to look at some of the other diagnostics that Keith has done. And it's kind of funny because when we came up with Cardio Essentials, we definitely saw that it had some lipid-lowering effects. And I said, Keith, out the information, and I really kind of forgot to follow through with him. And he was kind of following through with me and saying, wow, this has much more than just lipid-lowering effects, which is the whole premise of why we created this product. And I'm going to let you kind of finish up with, some of the diagnostics you've done to show the improvement on some of these nutrients.
Sure.
And it's quite amazing what you've done.
Yeah, so it's really neat. So as I mentioned earlier, I've got a patient handout that I can email you that has information about CoQ10 and statin research references. So a very common issue whenever a patient's taking statin is to provide them the information, or sometimes even the doctor. I still have doctors that state that you don't have to take CoQ10. And actually they may be correct. There may be a few that don't, but statistically there is an issue with that. So if you'll email me, I'll send you some information about that. And so one of my specialties is actually cardiovascular disease. I have a history of some problems, and not only in my family, but even myself, that I found and by accident as I was studying and learning about the heart, and that was back in 2002, and actually had some calcium in the blood vessels in my heart. I don't now. About a year and a half ago, I started doing some other cardiovascular tests, and the numbers weren't great. They're in their normal range now. So, so things can get better. So one thing that I was always searching for is how can we tell if there's a problem, with blood vessels in a patient. And one of the things that we can do besides, I didn't put the obvious thing on here, but I'll mention that, is systolic blood pressure. If systolic blood pressure is high, if it's above 120, there's a great likelihood that there's some type of a atherosclerosis event occurring, whether it be calcification or whatever's causing that. But the blood vessels get stiff, and the systolic number has a tendency to go up. Another thing you can do in the office that actually is recommended is that you should be doing a blood pressure in both arms. And so the blood pressure in the left and the right arm, the systolic number, even the diastolic number, should be within 10 points of each other. And that's actually a pretty wide range. And even if it's not within 10 points, it doesn't mean that there's not a problem. It just means that you just need to make sure that there's not another problem. and do additional testing. Maybe repeat the blood pressure test again. Start them on a program, repeat that, and do both arms. So I actually do both arms in almost all of my patients now. Another thing that you can do is do pulse pressure. This is something I talked about at the Zymogen Experience in Chicago. Pulse pressure is the difference between systolic and diastolic, and simple little math type thing. So whenever you or your staff takes a blood pressure, look at that number. If the number is above 50 or 60, according to two different journals, there's a problem. And so there is some blood vessels that are becoming stiff. I just talked to my patients. They're becoming stiff, and we need to do things. And then even if that math formula, if it falls under 35, they're actually at a greater risk of advanced heart failure or congestive heart failure. So with the blood, basically the heart's not pumping enough blood to increase the pressure. And there's actually some research about Alzheimer's, about how this low pulse pressure or even high pulse pressure is a risk factor for Alzheimer's disease. So that's another one of my specialty areas. One thing that I do in my office is real quick is we do what's called an Artersol Dynapulse system. And so it's a pulse wave system that is not expensive. It costs less than $5 per test. And we can actually measure the cardiovascular function and the response to supplements, medications, diet, and lifestyle. So I've got a website that's available called artersol.com. So check that out. If you want additional information, there's a place on there, information request, and then contact me about that. But this is how I actually can monitor the effectiveness of the cardiovascular products that I recommend, not just cholesterol products, but other products. And typically within a week or 4 weeks, I can show my patients that what they're doing is improving the function of their blood vessels. So it's a very neat test. So I think that's it, Mike. Yep,
that's great. I'm sure you're really pleased with the combination we put together for Cardio Essentials, and I'm sure it's something that's going to fit into what you're doing tremendously well, along with a lot of other practices. So we're real excited to have you come in and explain a lot of the science behind what we did put together. This is another product that we had many people put their thoughts and innovations in as far as our board of advisors, and you're one of our board of advisors. We really appreciate all your input that you do to bringing these things to Zymogen. So we're real happy to have you here, and like I said, it's always a pleasure. If you guys do have a question or two, you can type it in. We have a little bit of time left, and maybe Keith can answer that for you. One of the things I was going to ask you, Keith, a lot of the things that you showed were low dose, very low dose associated with, like long-term effects on cardiovascular disease.
Yes.
Do you see any promise with this by using one packet possibly long-term after we get some of the lipids and some of the other things under control, where people can actually be reducing to one packet long-term? Or do you feel that it's going to be, obviously it's going to be more effective at 2, but what's your initial thoughts on that?
Well, it's possible that decreasing the dose may help out. I've not tried that approach. I have done combination of the products and dropped one product off. And so, once again, as I mentioned, my personal preference is niacin. And so I've started off people with doing Regis and niacin, and everybody always gets fish oil anyway. And then after the cholesterol came down, I will evaluate and see if we feel like it's low enough, drop off the statin. And I don't know. I think it'd be worth looking at and trying, but it'd be just doing a lipid panel to find out what happens. And
there you go.
It depends on the patient too.
Yeah, absolutely. And, it's getting more and more cost-effective, too, to evaluate CoQ10 levels in patients, which we're seeing a little bit more of. And along with Cardio Essentials, we do now have a 100 milligram CoQ-Max CF that's out now as well. So that is not in the packet, but we do have the Cardio Essentials available with the 50 milligram per packet, which works out real nice. Let's see if we have any questions here. Yeah, we do. Here we go. Yes. This is an easy one. I can handle this one, actually.
Okay.
Can we get copies of your slides and articles quoted in your talk? I already sent all the slide information to you guys before the virtual conference started. And if you want articles quoted in the top, you probably can email Keith directly, or if that's okay with you, Keith. I don't know.
Oh, yes. So I just read the medical journal. So yes, definitely. Share this information. It's great to. I'd actually use some of this information for a little cardiovascular workshop that I had in my office. And so we had about 15 people here that were interested in doing alternative things, and I used some of this information. So by all means, I'm happy to share that information.
Excellent, excellent. The other question is, have you ever seen red yeast rice or any research showing red yeast rice can cause an increased liver enzymes, and or have you seen it working on the same enzyme function as statin medications such as HMG coenzyme A reductase? What's your thoughts on that?
Well, it's a possibility, but actually I've not seen any liver enzymes go up with red yeast rice so far. But once again, like I said, I've seen prescription versions of niacin issues, but I've not seen non-prescription issues with elevated liver enzymes. So, it is always a possibility, but I would not expect it.
Yeah, and here again, I want to clarify that I know this is the red yeast rice question, and looking at the possibility of increased liver enzymes, I haven't heard much of that or people talking about that. But also, the one thing I want to let everybody know is, the niacin that we use is an extended release mechanism. It's a little slower release than the methylcellulose that's in like a prescription, like a Niaspan. That flush rate tends to be around over 65%, whereas the documentation on the carnivore wax-based matrix that we have in our NIVAS product is only around 14, maybe 16%. So a little bit less, especially when you're given, a little bit smaller amounts, which it seems like the smaller amount of niacin can go a long way, especially with the right combination of nutrients, what we've tried to put together in the Cardio Essentials. Would you agree with that?
Oh, yes, definitely. Adding the fish oil, and, a combination with either one of those two products, you are going to see some great benefits. And so I have a family member, and that person is, just actually, doing a very simple maintenance type thing now. And triglycerides and blood sugars and everything was really not good at one time. And this person's lost over 20 pounds in the last year, and triglycerides are normal, cholesterol is normal, and we're just doing a very simple program now.
Wow. Got two more here. We'll follow through. This is a good question. Have you seen patients develop myalgia using red yeast rice? And any side effects associated with that you've seen with red yeast rice? Some know you've used a lot of that in your practice. Have you seen anything specifically?
No, I have not. Sorry about that phone ringing. So, no, I have not seen any issues with that. And so, at all. And once again, doses on that are actually low enough that I just don't think that it's going to be an issue. But
right.
Once again, I think it's wise and prudent. You want to know if lipids are coming down. At the same time, you do do the liver enzymes. Do a metabolic panel at the same time. It's wise, and it doesn't cost much. So, great thing to do.
Okay. Last one, and then we'll call it quits for tonight. We appreciate everybody joining us, and like I said, call the office if you'd like to get some Cardio Essentials coming in. I'm not sure about this question. If these products are ordered by your cardio doctor or PCP, may they be covered by Medicare or Medicaid? See many Medicare and Medicaid patients who may benefit. The facility discourages due to patient coverage. Great presentation. Thank you. What's your thoughts on that?
Well, I have a cash-based practice now, but as a former pharmacist, these products are not covered on insurance, and I really don't see that happening. It's especially on Medicare and Medicaid. I just don't see that happening. Now, although on some in the coastal areas, so we're talking about the East Coast, down to the Gulf Coast, the Houston area, and into California, there are more insurance companies that are starting to pay for this. As far as Medicaid and Medicare, I would not think so, but definitely there are some insurance companies that are starting to reimburse for some products with appropriate doctor prescribing and recommendation and such.
Yeah. And then here again, like I said, this is not just a lipid-lowering product. It's basically essentials for dealing with cardiovascular disease, and that's the way it was positioned. So the oxidation of LDL, dealing with all the inflammatory processes, making the molecule size large and fluffy as far as the the LDL, basically increasing HDL. So it's quite a unique product with a lot of mechanisms built in to be very supportive of cardiovascular disease and reduce that. So I think it's worth spending the money for, to be honest with you, as a patient versus getting some type of prescription product. So
a lot of times their copay, a lot of times their copay is going to be more than that. So
absolutely, especially if you're copaying, a couple different prescription products. You know what I'm saying? So this thing, I'm almost guarantee, will be a lot less copay with the amount of products that are in this. So that's great. Well, Keith, thank you for your time. Thank you all for joining us this evening. If you have any questions, you can email me to mike.mahoney@zymogen.com, or Keith, if you want to show your email address on closing here one more time, if you want to move that up.
Let's see here. I have to go all the way to the
So we have that?
I do. Take me a moment here.
Did you go too far?
Yeah, I pressed the wrong button, so let's see here. We're getting close to the end. There we go.
There you go. And that way they can contact you for any information. And here again, thanks again so much for your time. And Keith, thanks for preparing all the information. And we'll talk soon. Good luck with Cardio Essentials, everyone.
All righty, great. Good night.
Thank you.
Good night.